because the other area here is aged care. And again, there's plenty of detail to drill into, but the bottom line is this: state and federal governments and private operators have dropped the ball. It was clear from February and March that the elderly were the really vulnerable ones in this pandemic and that aged care homes were going to be the real trouble spots. There were outbreaks and deaths subsequently at 2 homes in Sydney, and over the past month or so we've seen more than 100 deaths in aged care homes in Victoria. Deaths in aged care are making up 2/3 of all deaths nationally, 3/4 of the fatalities in Victoria. Yet until a few weeks ago, after the horse had bolted, mask wearing was not mandatory in these facilities. In South Australia, only today they've issued new rules about staff not being able to work at more than one aged care centre at a time and for personal protection equipment to be mandated. Good, but these measures should have been in place in all states and nationally months ago. So at the Aged Care Royal Commission today, we heard a critical assessment of government actions.
On the central question of how well prepared the sector was for COVID-19, we will be submitting that it was not well prepared. There needed to be a planned, proportionate response to protect the elderly, frail residents in nursing homes from this pernicious virus. We say that the level of risk demanded a level of preparedness that was very high. This may be the key to why there is a disagreement between what we are saying and Professor Murphy's evidence yesterday that the sector was very well prepared. Tragically, not all that could be done was done.
That's pretty damning of the federal government and others. As we've often said, though, no one is going to get this whole pandemic response perfectly right. It's a diabolical dilemma. But the elderly and aged care facilities are overwhelmingly where our focus needs to be. And we've known that for months. Those people have been let down. Those aged care residents have been let down. And we need to fix this. We need to do as much as we can, as quickly as we can, because the virus is not going away, no matter how hard we lock down our societies. Just ask New Zealand. So unless we work out how to protect the vulnerable properly, we're going to continue letting them down. At the same time, we destroy reasonable prospects for our economy and broader society.